Hi, Jill Marlin here again from Peak Performance Physical Therapy. I have one more thing to share with you since our workshop is coming up very soon. I'm really excited about the back pain and sciatica workshop, and I know you're going to get a ton out of it. Again, you're going to get to see natural healing treatment and what that looks like without medications, injections, or surgery. You're going to get to hear other stories of people who are back to normal again, who got their life back and can now stand, walk, sit, and do everything that they want to do without pain. So this is super exciting for me, and I'm really looking forward to it. So also, I have something that I want to share with you here today, and it's one of the most common things that we see in regards to the cause of back pain. In the back pain and sciatica workshop, I'm going to share with you 3 common causes of back pain and sciatica. However, this one is about 90% of the people that we see in our workshop. So it's arthritis, stenosis, and disc degenerative disease. So today, I want to share with you exactly how that works, just to see if this fits you, or maybe not. Really quickly, we know blindly that if you're 50 years of age or older, or if you have pain with standing and walking that goes away when you sit down, or if you ever have heard yourself say, I just need to sit down for a minute, like my back is aching me, and then your back pain or your sciatica goes away when you do that, there's a 99% chance. So right here, 99% chance that this is what you have going on. So this is how it works. So I drew this out ahead of time. So when you look at this, so what are these things right in through here? And these are vertebra right here. So this is a vertebra, this is a vertebra. And what lays in the middle here is your disc. So when you look at the vertebra, it's the bone in your back, and the most common level for arthritis is the L4 and the L5 motion segment. And that would be between L4 and L5, and then L5 and S1 is going to be down here, which is really low in your back. But maybe you've had an x-ray or an MRI already, but you don't need one to come to the back pain and sciatica workshop. But if this is bone here, and this is bone that we're looking at, what happens as we age is, like right now, if you're of the age, let's say, of like 50, compared to the time when you're 25, are you taller now or when you were 25? Well, likely you've shrunk in time. And so there's 2 reasons that we shrink, with age. And so if you're looking at your disc space here, you have fluid on the inside of your disc. And so when you look at that fluid, one of the reasons can be that you lose the disc space because you lose the fluid as you age. The other reason can be just posture. So your overall posture is less upright in that position. So those are some of the reasons that we shrink, is the disc space and the fact that your posture just isn't as high. So one joke that I always tell in the workshop is that I played basketball in college, and I used to be 6'3", and now I'm only 5'7". Well, I did play basketball in college, but only in my dreams was I ever 6'3". So you won't hear about that. But most of us will lose a half an inch or an inch between the time we're 25 and the time when we're 65. So anyhow, that's the cause, it's caused by age. It's caused by that disc shrinking and for the vertebrae coming closer together. So what happens, this leads to arthritis, stenosis, and disc degeneration. And this is kind of how that happens. When the disc space shrinks down, the holes where the nerves come out, so right here are kind of that holes where the nerve comes out. Now this is your spinal cord that kind of runs down here, and this is a picture of somebody like this, so standing in a position like this. So they're going to be facing this way, and we're looking at the side of their spine right in through here. So this is going to be kind of the bundle of nerves where the nerve roots come out. And what happens is that when your disc shrinks, it makes this space where your nerve comes out a lot smaller. So what happens is these bones here then start to pinch on the nerves, which creates problems. It becomes soreness because those nerves are what generates pain. So I drew this, like I was talking about, for a person kind of facing this way, so that you have kind of just an orientation in through here. But typically when you see this, or somebody suffering with this, here's what they'll look like. So you'll kind of see them like in a forward position like this. So have you ever seen somebody, walking through Meijer's or Target or Costco, walking through the store, and they either tell you or they grab a grocery cart and they kind of lean forward like this over it, and they walk, through the store like this, and it's super comfortable as long as they have a cart. Well, the reason that they're doing that is that leaning forward is it opens up this space. So if you're in this position here and I bend forward, this is going to open up the space in through here. And so the pain that they have is going to be relieved because they're not pinching on the nerve anymore. So they have the pain when they're standing or walking because when they lean back or they stand up tall, they get the pinching and the space closes down, it pinches the nerve. So really simple, but that's kind of how that works as far as stenosis and some of the changes in your back. So that's the number 2 most common cause for back pain and sciatica is stenosis, arthritis, and degenerative disc disease. And it's a little bit about the mechanics of and how it all works too, so that can help you understand a little bit moving forward. But at the workshop, I'll share with you exactly what natural treatment looks like, specifically for these causes. So I'm really looking forward to seeing you there. You're going to really leave with a whole new perspective on life. So I look to see you at the workshop.